Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is current COVID-19 updates. What are the latest COVID-19 variants?
So right now, the variant of SARS-CoV-2 that is floating around is referred to as KP3.1.1. So it's basically a version of the Omicron strain of the virus, which originally showed up in 2021.
So how does this variant differ from previous ones?
All these variants are very similar to each other, yet at the same time they're slightly different. And the part that's different is in the structure of their, what we refer to as the spike protein. It's this particular protein structure that sits on the outside of the virus, and one small portion of it seems to change every so often, and therefore we end up getting new strains or variants of the virus.
What are the current recommendations for vaccines and boosters?
Right, so the current recommendation from the CDC is to ensure that people are vaccinated. There is a new round of vaccine that has been approved, and it was approved in August of 2024. So there's a new round of vaccinations available for what they call the 2024-2025 year. And the recommendation is, of course, if anyone has never received a COVID-19 vaccine, it's advised that they go get this one. If we are people who have been vaccinated before, or we've had booster shots of the older strains, the recommendation now is still to go ahead and get this, but this would be like a booster for what we've already taken. And this is the recommendation in general because, as you said, the virus has been changing, and therefore it is recommended that as the years go by and as the viruses keep changing, it would make sense for us to keep up with our protection. And so we would likely need to move on and start getting these kind of vaccines or boosters on a yearly basis, probably.
Can students get the vaccine for free?
Well, that's a great question. Right now, the NSU Student Health Center is offering the vaccine. What they have indicated is that if you have student health insurance, then it should be likely covered as part of your health insurance. Now, if you don't have insurance, then you will likely incur a cost for the vaccination at this point in time.
So the flu and COVID are both kind of going around right now. Is it recommended to get both vaccinations?
Absolutely. In fact, it is recommended to get the flu vaccine because it is flu season. Unfortunately, it is also the time of the year when COVID-19 could be floating around. And therefore, the recommendation is to get both vaccines. And research has shown, and the CDC recommends this as well, that there is no issue getting both vaccines at the same time. So that's not a problem at all. People can get both of them at the same time.
Any last thoughts?
The same thing as the recommendation from the CDC is that, especially if you are someone who belongs to what they refer to as high-risk categories, which again is if there are people who suffer from other conditions, or you happen to be traveling a lot, or you work in a hospital, or you're volunteering in a healthcare setting. These are considered high-risk settings or high-risk areas, and it would be a good idea for people in this subsets of the population to definitely get the vaccine so that you're protected, and at the same time, you also keep others protected and don't move the virus around in the population.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.